Hello, my name is Jeremy Dixon. I'm Deputy Director of ExChange, and I'm also a researcher focusing on adult care based at Cardiff University. I'm really pleased to do this introduction for our conference called Dementia Support in a Diverse World. There's a growing recognition by government that dementia poses a significant challenge for health and social care systems. The World Health Organization estimates that more than 55 million people are living with dementia, and that each year there are over 10 million more new cases. This challenge has also been noted in Wales. For example, by 2040, the number of people in Wales living with dementia is projected to rise by 40%. The term dementia is used to describe a range of diseases and conditions that can cause problems with memory and the ability to perform daily activities. Dementia worsens over time and is recognised as a terminal condition. Despite this, people living with dementia can live productive and meaningful lives if they are provided with the right support. Whilst there's been an increase in dementia research, many groups remain underrepresented. For example, a systematic review of dementia research by Muljic and colleagues found that most dementia research originates from the USA and Europe. Where participants' ethnicity was reported, people were white in 89% of studies. Similarly, researchers have often neglected to consider people's sexuality and other aspects of their identities. Our conference takes a fresh approach through focusing on how support can be provided to people living with dementia in a diverse world. It covers a range of topics which will be invaluable for social care practitioners. The conference includes several exciting speakers. Professor Rick Cheston from University of West of England gives a presentation called "You Can't Do That in Dementia Care." In this talk, Rick focuses on the needs of minority ethnic groups living with dementia and the poor service response they have historically received. His talk looks at how practitioners might work with community organisations to improve dementia care and focuses on some of the opportunity and challenges in taking this approach. John Hammond is a former carer for a parent who lives with Alzheimer's disease. He has worked as both head of services and acting CEO at Brighton and Hove LGBTQ switchboard. His presentation will explore the experiences of LGBTQ plus people living with dementia to provide guidance and best practices for working with this group. Sophia Vugio-Kalu and Julian Hallett will talk about supporting people with Down syndrome in Wales. They will talk about keeping well before, during and after a dementia diagnosis for people living with Down syndrome. Sophia is a researcher at the Centre of Adult Social Care Research, and Julian is a Services Development Manager at the Down Syndrome Association. Becky Oatley from Cardiff University will give a presentation called Food, Glorious Food. People living with dementia face a heightened risk of malnutrition and dehydration. However, food can influence well-being, creates a sense of citizenship, and supports personal and cultural identity. In her presentation, Becky reports on research into a community-based group support, which looks at how activities based around food might improve the well-being of people from diverse backgrounds. In the next year, we aim to produce more podcasts for social care practitioners, which people can listen to whilst on the go. This conference will feature an interview between myself and Professor Suzanne Carhill. It will focus on her work on dementia and human rights, and will focus what this means in practice and what benefit it can bring. We hope you enjoy this conference on dementia in a diverse world. We look forward to seeing you at the presentations and hearing what you have to think about the presentations as well. Thanks for listening.